This gentleman fell and he broke his hip. And after he broke his hip, he came home and he got weaker and weaker. And they had to put a Foley cath in because he couldn't really get to the bathroom. We ended up developing a UTI. We took him in a couple of times for the UTI. And eventually he ended up passing away because he fell. Because he was stretching his medication. Because he didn't come to the clinic. Because, he couldn't get there.
Across America, nearly 6 million people delayed medical care in a single year because they lacked a reliable ride. In Nashville, nearly half of African American riders depend entirely on transit.
Sometimes I drive. I have transportation, but most of the time I use the bus, public transportation. First of all, there's the bus, 2 buses. Yeah. And it takes all total about 45 minutes. Being able to get a ride if I have to use Dollar Ride, which is the transportation, because there's so many people now that's using it, I have to schedule at least about 3 weeks in advance. That can be very inconvenient. My situation is different and it's not as bad as some others, and I know some that are complicated, young mothers who have children and very low income. There are people that are handicapped.
In Nashville, 44% of the African American population is transit dependent, with a 15% citywide poverty rate in transit deserts.
The access to primary care in certain areas and subspecialty care has been compromised by that rapid growth.
Everywhere you look in Nashville, you see growth, whether it be cranes, brand new buildings, or simply more people. According to 24/7 Wall Street, in the last 5 years, Nashville's population has grown by nearly 10%.
The city has transformed into one of the nation's fastest growing boom towns, with a record 16.8 million visitors last year, adding nearly 90 people a day to its population.
According to a new study by Forbes, even, Nashville is the city with the worst commute in the United States.
There are a lot of transportation problems despite the patients being very well insured, and they just have trouble because of their age and mobility issues getting to see primary care and sometimes missing appointments because of that, or coming to the emergency room because the only transport they can find is an ambulance that can come pick them up at their home and bring them here, but no way to get to a clinic appointment.
Trying to take the bus system to a clinic, Vanderbilt's now, some of their clinics are at 100 Oaks, and some of them are at the hospital. It's really difficult for them to get there. And if they're, like I said, if they're not ambulatory, they can't call an Uber or a cab to get there either because they can't really sit up straight. If they can't get to the hospital any other way and they call us, we can only go to the emergency department. We can't take somebody, to a clinic or anything like that. It's very limited what we're able to do. I mean, we can take you to the hospital or we can take you to the hospital.
Readmission is the thing I keep bringing up because that's often what lack of transportation results in. So if you can't get the care you need, you can't get to that care you need, then you show back up in the emergency room, sicker than you should be, you're likely to get readmitted.
If they end up in the ER for several visits in a row instead of that follow-up with primary care who's established and knows them, or cardiology knows them, we in the ER aren't as good at managing those chronic illnesses, just to be frank, and they end up more likely to be admitted because of that.
And emergency departments get overcrowded, especially Vanderbilt being a level 1 trauma. If you've got something minor, you may sit there in a hallway bed for 12 hours because every time the physician tries to get to you, a level 1 trauma comes in.
Chronic diseases like congestive heart failure, end-stage renal disease on dialysis, missed a dialysis or missed an important appointment with a cardiologist that resulted in a gradual exacerbation of their chronic illness that resulted in an ER visit.
One of the most common ones we see is for missed dialysis appointments. Very difficult for patients to get to those because they're timed and specific, and the consequences are high when you miss one or two. There are lots of ways it affects us. So some of these patients are uninsured, so probably a greater proportion of these than other patients. So that's one way it affects us negatively from a financial perspective.
Failure points is always proper planning, infrastructure. I think a lot of our leaders, when you plan for growth, when you plan for future development, too often we don't look into the future saying, how are we going to get transportation there? How are we going to get schools for our kids? I don't believe that the planning a lot of times is based upon future needs as it is on financing for the current builders.
Having another resource to reach out to if they're realizing that they aren't doing well, and helping them get into primary care or specialty care would be good. And then as far as discharging them from the emergency department, having that confidence that they're actually going to end up somewhere, I think would be helpful.
Ability to have to get a ride at a particular time, that would be perfect.
Wouldn't it be perfect?
Yes. In a perfect world. Hopefully I don't have to come to the doctor so often. So, but if we had that ability, if I have that ability, then it would change a lot.
I think with the money that we spend on ER visits and ambulance transportation, that they could save by just having a simple transportation. I think it's absolutely something that we could do and save money.
This is the story where power and interest collide. Hospitals and clinics carry influence as every missed appointment affects revenue, quality, and continuity of care, but their focus is on reaction rather than prevention. Under-resourced residents, the ones most affected, have the greatest stake, and yet they have the least voice. Physicians and paramedics care deeply, but lack the authority to redesign the system. Policymakers hold decision-making power, yet their focus shifts with election cycles. So, as power and interest collide, blame replaces action. The chaos stays exactly where it began. Nashville is trying. The Choose How You Move plan, a $3.1 billion investment, but without integration into healthcare and without tracking health outcomes. The Journey Pass offers fare-free rides to thousands of low-income residents, but without coordination with safety net clinics, access stops at the bus stop, and missed appointments remain missed care.
Well, you need to come up with a plan. They need to come up with a plan.
Our innovation is Nashville Health Bridge, turning transportation into care itself. We identify high-risk patients directly within the EHR. Within 2 hours, a navigator steps in. Rides are verified, scheduled, and tailored to urgency. Our vision is simple. No patient misses care because of a ride. We're driving no-show rates down from 23% to under 2%. For hospitals, the numbers tell a story. A single avoidable emergency visit costs $7,000. We aim to cut that by 30%. We are built as a public-private partnership, a 501c3 nonprofit, by design, because alignment matters. Hospitals, payers, government, and community are moving as one. Our leadership is more than a boardroom. It's a community. Hospital executives, payers, and patient advocates sit side by side. Our journey unfolds in 3 phases. First, we lay the foundation, integrating seamlessly into hospital EHR systems and locking in trusted transportation partners. Next, we open the doors to 2,000 high-risk patients, Medicaid families, and frequent emergency visitors, finally, we measure what matters, refine what works, and expand hope to 5,000 lives. 73% of U.S. hospitals already have the digital backbone, EHR systems with API capability. In Nashville, more than 15 medical transportation companies stand ready to move patients. A sustainable model generating $2.75 million in diversified revenue, strengthening hospitals while serving communities. 18% of Davidson County residents don't have access to a vehicle. For them, a missed ride can mean a missed diagnosis, a missed treatment, a missed chance. Nashville Health Bridge turns technology into access, and access into equity.
Another sunrise on these Nashville streets, driving through the day and all its heats. Oh, Nashville Health Bridge shining light the way, guiding me through the city night and day. Yeah, Nashville Health Bridge, strong and true, help me make it all the way.